The warehouse is miles from the hospital in an undisclosed location.
It's important that we kind of keep the location under wraps.
Boston's Mass General has been getting ready for a pandemic for years.
Most of it is personal protective equipment. It's the gloves, it's the gowns.
But this emergency cache of supplies, as impressive as it may seem, is only a stopgap.
The goal was to give us about a 2-week buffer.
2 weeks?
2 weeks.
That's not a lot of time.
It's not a lot of time.
We are working closely with our state public health partners.
Mass General activated its emergency operation plan weeks ago.
This, no question, is the hardest possible kind of surge planning for us. Not just more patients, but more patients that need specialized equipment in a specialized space.
The N95 masks are low, but that isn't the only concern. In a worst-case scenario, they may need more ventilators.
We also do have strategies in place to use our ventilators in very unusual ways, such as putting 2 people on 1 ventilator.
Do you worry about actual drugs, pharmaceuticals?
I absolutely worry about drugs.
Last week, the FDA announced the first known drug shortage because of coronavirus. Much of our drug supply depends on manufacturing in China.
Are there particular drugs or categories of drugs that you really have your eyes focused on right now?
I think some of the antibiotics.
Antibiotics, the stuff we use every day.
Every day.
Looking ahead, Dr. Paul Bittinger has a message.
We have to all come together as a society. If everyone comes to the medical system for evaluation, even with mild symptoms, it overwhelms the medical system.
Even at one of the top hospitals in the country. Stephanie Gosk, NBC News, Boston.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.